Maya clutched her jacket tighter as she hesitated outside the emergency room doors. The fluorescent lights cast an intimidating glow through the glass, and her heart hammered against her ribs. She'd been putting off this visit for weeks, but the pain had become unbearable. Taking a deep breath, she pushed through the doors and approached the reception desk. The nurse, a kind-faced woman in her 50s, smiled warmly. "How can I help you, dear?" Maya's cheeks burned as she whispered her symptoms, grateful when the nurse handed her forms without judgment. After what felt like hours in the waiting room, her name was finally called. "Maya Chen? Room 3, please." She followed the nurse down a sterile hallway, her sneakers squeaking against the polished floor. When she entered the examination room, she was surprised to find a young doctor, probably close to her age, reviewing her chart. He looked up with the kindest brown eyes she'd ever seen. "Hi Maya, I'm Dr. Alexander Hayes," he said, his voice gentle and reassuring. "I understand you're experiencing some discomfort. Please, have a seat and tell me what's been going on." Something about his demeanor immediately put her at ease. Unlike other doctors she'd encountered, he didn't seem rushed or impatient. He listened intently as she explained her symptoms, nodding thoughtfully and asking follow-up questions without making her feel embarrassed. "I know this is uncomfortable to discuss," Dr. Hayes said softly, "but you did the right thing coming in. Many people wait too long because they're embarrassed, but there's nothing to be ashamed of. These issues are more common than you think." As he conducted the examination, he maintained a professional yet compassionate demeanor, explaining each step and ensuring her comfort. Maya found herself relaxing for the first time in weeks. "The good news is, this is completely treatable," he said afterward, pulling up a chair to sit at her eye level rather than towering over her. "I'm going to prescribe some medication that should clear this up within a week. But I also want to give you some information about prevention." What struck Maya most was how he took time to educate her, drawing simple diagrams and explaining things in terms she could understand. He even wrote down care instructions in neat handwriting. "Dr. Hayes," she said as he finished writing, "thank you for being so kind. I was terrified to come here." He smiled, and she noticed how it reached his eyes. "Maya, part of healing is feeling safe and respected. You're brave for taking care of your health." As she prepared to leave, Maya couldn't help but notice the small details about him, how he'd sanitized his hands multiple times during their interaction, how he'd made sure she was comfortable throughout, and how he'd never once made her feel judged. "If you have any concerns or if symptoms persist, don't hesitate to come back," he said, walking her to the door. "And Maya? Take care of yourself. You deserve to feel well." Over the following week, as the medication worked and her symptoms disappeared, Maya found herself thinking about Dr. Hayes's kindness. She'd never experienced such genuine care from a healthcare provider. 2 weeks later, she returned to the hospital, not as a patient, but carrying a small potted succulent and a thank you card. She approached the reception desk nervously. "I'd like to thank Dr. Hayes for his excellent care," she told the nurse. "Is it possible to leave this for him?" The nurse smiled knowingly. "Dr. Hayes is actually finishing his shift. He might be in the break room if you'd like to thank him personally." Maya found him sitting alone, still in his scrubs, looking exhausted but peaceful as he sipped coffee and reviewed patient files. She knocked gently on the doorframe. "Dr. Hayes? I hope I'm not interrupting." He looked up, surprised but pleased. "Maya. How are you feeling? Is everything okay?" "Everything's perfect, thanks to you." She held out the plant and card. "I just wanted to thank you properly. You made one of the most embarrassing experiences of my life feel normal. Safe." He accepted the gifts with a genuine smile. "This is incredibly thoughtful, but really, I was just doing my job." "No," Maya said firmly. "You went beyond your job. You treated me like a human being, not just a condition to diagnose. As they talked, Maya learned that Dr. Hayes had grown up in a modest household and worked his way through medical school with scholarships and part-time jobs. Despite his success, he remained grounded and committed to treating every patient with dignity. "You know," he said, "patients like you remind me why I became a doctor. It's not about the prestige or the money, it's about moments like these, when someone feels better because of something I could do to help." What Maya didn't know was that Dr. Hayes came from considerable family wealth. His grandfather had built a successful business empire. But Alex had chosen to work in public healthcare, using his trust fund quietly to pay off medical school debts for struggling students and to donate equipment to underfunded clinics. Their conversation flowed naturally, and Maya found herself sharing stories about her work as a children's librarian, while Alex talked about his volunteer work at free clinics on weekends. "Would you like to get coffee sometime?" Alex asked as their conversation wound down. "As friends, of course. I'd love to hear more about your library programs." Maya's face lit up. "I'd like that very much." 6 months later, their friendship had blossomed into something deeper. Alex's kindness extended far beyond the hospital. He remembered details about her life, supported her dreams of starting a literacy program for underprivileged children, and treated everyone from janitors to hospital administrators with equal respect. When Maya finally learned about his family's wealth, it was through a newspaper article about his anonymous donation to build a new children's wing at the hospital. She confronted him gently. "Why didn't you tell me?" she asked. Alex shrugged, looking almost embarrassed. "Because it doesn't define who I am. My actions do. My grandfather always said that true wealth isn't what you have, but what you give back." Maya realized she'd fallen in love not with a wealthy doctor, but with a man whose heart was richer than any bank account, someone who had shown her that genuine kindness could heal more than just physical ailments. Their love story began with vulnerability and blossomed through compassion, proving that sometimes our most embarrassing moments can lead to our most beautiful connections.